This is Mayor Oliver Gilbert, and we've gone virtual. Now, I wanted to make sure that we had the opportunity to learn how to save a life while staying at home. Join me for CPR with Dr. Carrington. Let's learn how to save lives together.
Welcome back to Virtual CPR First Aid Educational Training. We hope you're enjoying the weekly sessions and that you're learning. Let's get to another session. Most of us have had a bloody nose at some point in our lives. It simply means bleeding from the inside of the nose due to some form of trauma. The biggest cause of a nosebleed is digital trauma, which is picking in the nose with your fingers. When you or someone has a nosebleed, this is what you should do. Lean slightly forward, not back. Pinch the nose just below the bridge. Do not pinch the nostrils closed by pinching too low. Check after 5 minutes to see if the bleeding has stopped. If not, continue pinching the nose and checking every 5 minutes, meaning after 10 minutes, after 15 minutes, and so forth. If the bleeding continues or is the first nosebleed, contact emergency services by calling 911. You can also apply a cold pack or compress to the bridge of the nose while pinching the nose. Let's take a look at a few types of facial bleeds and what you should do.
As a rescuer, you may be asked to help someone who has a nosebleed or is bleeding from the mouth. There are some things you can do to help stop this bleeding.
Jess, they called and said you were having trouble. What happened? Can I help?
Yeah, I need help. I don't know what happened. My nose just started bleeding.
Okay, well, come sit down for me. I'm sure you're going to be all right. Okay, right there. No, lean your head forward. You don't want to lean your head back when you're trying to stop a nosebleed. Okay, I'm gonna pinch your nose pretty hard with this gauze for several minutes.
That.
A nosebleed is bleeding you can see, so the first aid action is to stop the bleeding with pressure. First, make sure the scene is safe. Put on protective equipment. Ask the victim to lean forward. Press both sides of the victim's nose with gauze for a few minutes until the bleeding stops. If bleeding continues, press harder. Phone for help if the bleeding does not stop in about 15 minutes. If the bleeding is heavy, such as gushing blood, or if the victim has trouble breathing. Like other bleeding you can see, bleeding from the mouth can usually be stopped with pressure. A mouth injury can be serious if blood or broken teeth block the airway and cause breathing problems. If bleeding is coming from the tongue, lip, or cheek, and you can reach it easily, press with sterile gauze or a clean cloth. If bleeding is deep in the mouth and you can't get to it easily or you don't know where it's coming from, ask the victim to lie on his or her side and phone for help. Check for signs of shock and watch the victim's breathing. Sometimes when a person suffers a mouth injury, one or more teeth may become broken, loose, or knocked out. This can be a choking hazard. First, make sure that the scene is safe for you and the victim. Send someone to get the first aid kit. Put on personal protective equipment. Check the victim's mouth for any loose or missing teeth or parts of teeth. If a tooth is loose, have the victim bite down on a piece of gauze to keep the tooth in place and call the dentist. If the tooth is chipped, gently clean the injured area and call a dentist. If the victim has lost a tooth, rinse the tooth in water, put it in a cup of milk, and immediately send the victim and tooth to a dentist or emergency department. Tell the victim to talk with a dentist if a tooth changes color after an injury.
Thank you for watching. Remember, everyone can learn to save a life. See you next week for more educational training on first aid and CPR.
I hope you enjoyed today's session and I hope you learned a lot. Join us every Saturday at 10 o'clock a.m. on Facebook Live for CPR with Dr. Carrington. If you want to view this session again, just to brush up on your skills, visit cmgengage.com/virtual. We'll see you next week.